From the time we make patient contact, we have about 20 minutes to resuscitate them before death becomes imminent.
Hey, we're just trying to help you settle down.
Very, very large damage to the driver's side.
You're going like 100, 110.
You're responding echo for a 28-year-old female, possible overdose on fentanyl. She is not conscious, not breathing.
Fentanyl is a very strong drug. It's 80 to 500 times stronger than morphine. It can cause people to lose consciousness and stop breathing.
You're arrested?
Yeah, we're 99.
We're 99.
We don't know anything about her. Friends found her 10 minutes like this.
You know, any call for cardiac arrest, every minute, every second on this call makes a difference in the outcome of this patient.
We don't know what she used. Can anyone go talk to the people?
We are literally working against the clock. From the time we make patient contact, we have about 20 minutes to resuscitate them before death becomes imminent.
Once we got a pulse when they got here, because we give her CPR for 15 minutes and give her that emergency.
Check the pulse, guys.
Every 2 minutes we check for a pulse. If there's no pulse, CPR continues.
She's asystole. Let's get back on the chest. I'll dump this charge.
So the longer a patient is in cardiac arrest, the less chance of survival they have.
Okay, second epi's going in.
We're approaching that 20-minute mark, so this is now a last-ditch effort of what we can do to resuscitate this patient.
So we got about 5 more minutes and it's 20 minutes, guys. Pupils are fixed and dilated.
Chest, asystole.
Okay, are we calling it right now?
Yeah.
We're gonna call it, okay.
2354.
That's right, 2354, we'll call it. Everyone's cool with that?
We did everything we could. Unfortunately, at this point, there's nothing else that can be done. It's a very tragic situation. You know, you feel for the patient, you feel for the patient's family and friends. And unfortunately, it's a growing crisis where all it takes is one bad dose to end up in a fatality.
1967. You're responding to Delta for an unknown female, unconscious, breathing status unconfirmed.
Anybody laying on the sidewalk?
We really don't have a whole lot of information going into this call. We could be going for someone who's simply intoxicated, or we could be going to a cardiac arrest.
Yeah, I'll put the lights on.
67's our patient.
Hey.
Good morning. Hey, what's your name? Let's go sit in the back of our truck where we got some good lights. This way. Our patient's confused, she's agitated, she doesn't want anything to do with us. But because of her state of mind, we have to take her to the hospital. Right this way, right this way. Can you step up? Oh, she's trying to bite. No.
We really just wanted to help her, and we can't leave her laying on the sidewalk.
No paramedic wants to restrain a patient, but sometimes our job is to protect people who can't protect themselves.
What's your name? Hey, we're just trying to help you settle down.
As that foot's coming at my head, I'm feeling, hey, this is really going wrong. And I do not want to be kicked in the head tonight. We then tie her down, because if I don't, she's going to try to kick me one more time.
No track marks anywhere, no sign of any injury. For this young lady, unknown what she took. Very combative, unable to get any information whatsoever from her. No name, no allergies, medical history. Use a soft restraint as well as give her some midazolam to put her to sleep for now, just so we can manage her better. We'll get her up to the hospital, see if we can't figure out what's going on with her.
Base to 46. Responding Delta for multi-vehicle NBC. Multiple patients on scene. One vehicle rolled.
We had 5 people in this car.
Yeah.
You're doing the front, feel the back.
Drivers
PTO.
the worst. They're doing in excess of 100 when they hit the truck.
100?
Yeah, you're gonna have to take a look at the car because it looks pretty bad.
You're going like 100, 110.
The dangers of this are astronomical. You know, 5 people in this car traveling in excess of double the speed limit.
Very large damage to the driver's side.
12 to 18 inches intrusion on his A-post.
parked.
This was a parked vehicle.
Yeah.
He's probably going over 100. He lost control and then started to fishtail, and then I just saw the one side come up, and then he made contact with the two vehicles that were there.
Do you remember the whole accident?
I do.
There's no periods where you're kind of foggy.
All I remember is hitting it and flying around the bike.
Did he climb out of here?
Yeah.
Other patients are being assessed, and there are some very young teenagers involved.
So the girl in the blanket didn't want...
No, Dad's gonna take her.
Yeah.
Coming home from work, driving this way, and this car went zooming by us.
Turns out this witness got a bit of a surprise.
But your daughter was...
In the car.
It's not a good night.
No. Not the night I was planning on having.
No.
Every paramedic has shown up to a call that has much less extensive damage, but much greater injuries. So the fact that these patients walked away is almost a miracle.
Base to 36. Reporting that unknown aged male. He's unconscious, breathing is concerns. And this is a Delta response to a 5-year patient outside this address.
He's gonna be wet if he's been outside for any length of time. It's
cold.
It's a cool night, a definite potential to lose body heat. We walk up to this patient. He's lying flat on his back. It's dark, it's a tight space. It's less than ideal for treating this patient.
Started breathing like this now.
Okay.
Hey, slow your breathing down, okay?
Right now, we're not really sure what's going on with him. His eyes are closed. He's not answering any questions. He's hyperventilating.
Police plane followed him here. Plane did, they said.
Yeah, you could see him get out of the driver's seat and walk up here and come back.
This police plane was able to follow this erratic driver. They watched him park, they watched him walk up to his house, and then fall backwards off his top step.
He's got a pretty big goose egg to the back side of his head.
It is possible this gentleman is just intoxicated. However, we don't want to overlook a more serious injury.
We're gonna put a collar around your neck.
This patient's behavior is becoming erratic, it's very unpredictable, and it creates for a possibly unsafe situation.
Open your eyes. Open your eyes. Sometimes people with a head injury can become confused and combative and not really know what they're doing.
Look at him fight, he's clenched. His heart rate's 60, he's got a pressure of 150 on 100. He could be showing signs of ICP.
There definitely is potential that this patient has a head injury, and that is what is causing this erratic behavior.
Start a line if I just go.
Yeah, I'd like to just go.
Patient's a very tough assessment, so we're just gonna be overcautious and take him to RUH for a trauma alert.
Base to 67. You're responding to an unknown aged female. She's extremely short of breath. We can no longer hear her on the phone. Unsure if she's still conscious.
1967 copies that. Suddenly she's not on the phone with dispatch any longer. I'm thinking, did she go unconscious? Did she just drop the phone? What's going on? Paramedics!
You can see the patient's in distress.
Okay, let's get you sitting down here.
She's only talking 2 or 3 words at a time, and you can hear her wheezing from the doorway. Hey, how are we doing?
Hey, well, listen, you sound wheezy. Okay, so we're 96 sats. Heart rate's 124.
Are you having pain in your chest?
Let's get you breathing.
We gotta get you breathe. Just concentrate on taking breaths, okay? You don't have to talk to us.
Breathe out, you'll be okay. We'll get you breathing in.
This patient is in pretty significant distress. The apartment's very hot and stuffy. There's hardly any air movement, and it just feels very stagnant.
What's your first name?
Open that window. We need to get some cold air in there. It's going to make her ability to breathe a lot easier. It's going to open her up because it is going to cool down the room. When did you quit smoking? 96. 10 years ago.
Okay,
Take deep breaths.
She's been a long-time smoker, and as a result of the smoking, she's developed emphysema.
That medication's going to get into the base of your lungs, okay, and open them up. Just breathe so you can hear.
Don't answer me yet.
Sats are good, heart rate's coming down.
Are you by yourself here? Yeah? Yeah, it's just a little guy.
We're going to take you up to the hospital, okay? Need to get a chest x-ray and some more steroids.
Unfortunately, emphysema is a chronic condition, and the symptoms can only be managed. 2,
Watch behind
3,
your butt.
4.
Problem with these emphysemic patients is some nights are good, some nights are bad, and nothing seems to help. Even when they take their meds, they just get that exacerbation and just builds up and gets worse, and that's when we get called.
Her oxygen stats are improving, her work of breathing is improving, her heart rate is improving, and her anxiety level is improving. You feel better? Yeah, good. Breathe that in. Here, let's get you fixed up. That tells us our treatment plan is working.
You're doing in excess of 100 at this parked car. 100?
Regarding the intoxicated male at the start of the night who crashed into the parked cars.
You're going like 100, 110?
He was transported to hospital, treated for minor injuries, and later released into police custody.
So the girl in the blanket didn't want...
No, Dad's gonna take her.
The 4 remaining passengers in the car were also transported, treated for minor injuries, and later released.
Paramedics!
Our emphysema patient earlier this evening was transported to hospital. She spent 3 weeks there recovering and is now home with her dog.
The female that we went to earlier in the evening that was unconscious on the sidewalk, we transported her to the emergency department. She was watched for the rest of the evening and released in the morning.
Is there arresting?
Yeah, we're 99.
We're 99.
We don't know anything about her.
The overdose patient from earlier in the night did not respond to any resuscitative efforts.
We don't know what she used. Can anyone go talk to the people? Thank you.
And unfortunately was pronounced dead at the scene.
Just cover her up.
It's truly a tragedy. You know, we're seeing this growing crisis within the city, and there are more deaths because of it.